1992, and estimated that 10% of all healthcare expenditures are fraudulent, minimal estimate. Since then, the leading expert in the world on this is Professor Malcolm Sparrow, cited in here. He's an applied mathematician at Harvard, and that is his rock bottom estimate. He thinks it's much higher than that, could be 20%. This isn't medical malpractice and quackery. We're talking billing fraud. Is that you don't get that in Canada, for example. And you know from your own experience that if you have a relative who's gone through an extensive medical treatment, and then the bills start coming, and they're separate bills. The anesthesiologist bill, the surgery bill, this, that, trying to figure out what in the world is going on. Think of that as quality of life. And then nobody in Canada dies because they can't afford health care. In the US, 40,000 people, minimum, Harvard Medical School peer-reviewed study by Wollander and 2 doctors. That's 800 a week. Over 100 people today, 100 people on the average, die because they can't afford health insurance to get diagnosed in time. So, they're not talking about that. The advocates for single payer, which is a bill in Congress, in the House, and it's supported by 113 Democrats, and only one member of the House of Connecticut, Joanna Hayes. All the rest still are under the influence of that now. And this bill is 1384, HR 1384, and it's a very comprehensive single payer. Now, single payer means government pays the bills and there's private delivery. This is not socialized medicine like in Britain, where the hospitals are owned by the government and the doctors are employed by the government. It's a Canadian type system, public funding and private delivery. Now, the key question I have that I've never answered is how can people take this? How do people take this brutality, this greed, this nonsense? Now, if you're driving at night on Route 44, and if you had your headlights angled to the side of the road, that is, they illuminated the woods, and you're trying to find your way down Route 44, what would people think of you? You might lose your license. That's where we are. The only reason this is the case is 535 members of Congress. And the agony people go through every day. Can we pay for it? Can we get it? Is it available? Is it competent? Is it accessible? And the agony and the billions of hours and the deaths and the injuries and the pain and the suffering and the dread and the anxiety. 535 people get away with it. Tell me about our elementary school education. 535. It's like going down Route 44 without headlights on the road. And there's an ancient Chinese comment by Lao. He's a famous Chinese philosopher. It's over 2,000 years ago. I don't know how he came up with this. He had no email. Lao Tzu is almost as famous as Confucius. He said, if you don't change direction, you may end up where you're heading. Okay. Now, here's where we're heading. People say, when Lyndon Johnson got through Medicare and Medicaid, it was 1964 or so, He wanted to go all the way. Medicare for all. The message came back from Congress. You know, Lyndon, you got the votes. But you forgot about one thing. The Vietnam War and what it's costing us. If it wasn't for the illegal Vietnam War, we would have saved 1.5 million American lives here. If we would have had full Medicare. Nobody would have died because we couldn't afford health insurance to get diagnosed, treated in time. That doesn't even count the injuries and the sickness, disease that occurs because they can't get treated in time.